Welcome. If you are over 60 and you've been told that weak bones, joint pain, or fractures are just a normal part of aging, this video may change how you think about bone health forever. Most seniors worry about osteoporosis only after something goes wrong, a fall, a fracture, or sudden back pain. By that point, bone loss has already been happening silently for years. Bones do not weaken overnight. They deteriorate slowly, quietly, often without pain, until one simple movement causes serious injury. The good news is this: bone loss after 55 is not inevitable, and strengthening bones does not always require expensive medicines, injections, or lifelong supplements. There is one cheap, everyday food that strengthens bones almost like medicine when used the right way. Most seniors already have it in their kitchen, yet very few use it correctly for bone health. Stay with me until the end, because understanding how this food works inside your body is just as important as knowing what it is. Before we continue, if your goal is to stay independent, avoid fractures, and keep moving confidently as you age, take a moment to like this video and subscribe. It helps us reach more seniors who need reliable, doctor-guided health information. Now, let's talk about why bones weaken after 55. Bone is not a dead structure. It is living tissue, constantly breaking down and rebuilding. In younger years, bone formation is faster than bone loss. After age 40, this balance begins to shift. After 55, especially in women after menopause and men with reduced testosterone, bone breakdown accelerates. At the same time, calcium absorption decreases. Stomach acid weakens, vitamin D levels drop, and medications interfere with mineral balance. Even seniors who eat healthy may still lose bone density. Weak bones affect much more than fracture risk. Bones are the foundation for muscles. When bones weaken, muscles lose stability. Balance declines. Walking becomes cautious. Fear of falling increases. Independence slowly fades. That is why osteoporosis is not just a bone disease, it is a mobility disease. Many seniors turn to calcium supplements as a solution, but supplements are not always the answer. Calcium pills often provide large doses that the body cannot absorb efficiently. Excess calcium may pass through the digestive system unused, or worse, deposit in arteries instead of bones. Supplements also lack important co-nutrients like magnesium, phosphorus, protein, and vitamin K that guide calcium into bone tissue. This is where food-based calcium becomes critically important. Food delivers calcium in smaller, safer doses, along with natural compounds that improve absorption and bone integration. And among all food sources, one stands out for seniors. That food is plain yogurt. Yogurt is not just a dairy product. It is a functional bone support food when used correctly. Plain yogurt contains calcium in a highly bioavailable form. But more importantly, it contains protein, phosphorus, magnesium, and in many cases, probiotics, all of which play a role in bone strength. Bones are not made of calcium alone. Nearly 50% of bone structure relies on protein and collagen. Without adequate protein, calcium cannot be effectively integrated into bone tissue. Yogurt provides both. In addition, probiotics in yogurt improve gut health. This matters more than most seniors realize. Calcium absorption begins in the intestines. If gut health is poor due to aging, medications, or chronic inflammation, calcium absorption drops significantly. Probiotics help restore gut balance, increasing mineral absorption and reducing inflammation that contributes to bone loss. This means yogurt does something supplements cannot. It improves the environment where calcium is absorbed. Now, here's a critical point many people miss. Timing matters. Bone rebuilding is most active during sleep. At night, growth hormone release increases. Tissue repair accelerates. Bone remodeling occurs primarily while the body is at rest. Consuming calcium-rich foods earlier in the day does not fully support this process, but consuming the right calcium-rich food in the evening or before bed aligns nutrients with your body's natural bone-building rhythm. This is why doctors increasingly recommend yogurt at night for seniors with bone weakness. But not all yogurt is equal. Sweetened yogurts, flavored yogurts, and low-protein varieties do not offer the same benefits. Added sugars increase inflammation and may worsen bone loss. Artificial flavors offer no nutritional value. The best choice is plain, unsweetened yogurt, ideally full-fat or low-fat, depending on your doctor's advice. Full-fat yogurt provides vitamin K2 in small amounts, which helps guide calcium into bones instead of arteries. It also improves satiety and blood sugar stability when consumed at night. Now let's talk about quantity. Seniors do not need large portions. In fact, smaller amounts are safer and more effective. A single bowl, approximately 150 to 200 grams, provides a meaningful amount of calcium, protein, and probiotics without overwhelming digestion. Eating more does not mean absorbing more. Your body absorbs calcium gradually, not all at once. This leads to an important question many seniors ask. What if I'm lactose intolerant? True lactose intolerance varies. Many seniors can tolerate yogurt better than milk because probiotics partially break down lactose. If discomfort occurs, lactose-free yogurt or fermented yogurt options are available. Another question is often asked, is yogurt enough or do I still need supplements? For many seniors, yogurt combined with vitamin D, adequate protein, and gentle strength exercise can significantly slow bone loss. Some may still require supplements depending on medical conditions, but food should always be the foundation. Vitamin D deserves special attention. Without vitamin D, calcium absorption drops dramatically. Even the best food will not work properly. Vitamin D comes from sunlight, fatty fish, egg yolks, and fortified foods. Seniors should aim for regular, safe sun exposure and discuss vitamin D testing with their doctor. Another critical nutrient is vitamin K2. Vitamin K2 directs calcium into bones and keeps it out of arteries. Without K2, calcium may increase vascular stiffness instead of strengthening bones. Vitamin K2 is found in fermented foods, certain cheeses, and small amounts in full-fat dairy. Yogurt contributes modestly, but combining yogurt with K2-rich foods improves safety and effectiveness. Now let's address medications. Many seniors take medications that affect calcium balance: blood pressure drugs, thyroid medications, acid reducers, and antibiotics. Calcium can interfere with medication absorption if taken at the wrong time. This is why yogurt consumed at night is often safer. Most medications are taken in the morning. Separating calcium intake by several hours reduces interactions. However, seniors on thyroid medication must be especially careful. Calcium should be consumed at least 4 hours after thyroid pills. Always consult your physician before making dietary changes, especially if you have kidney disease, heart conditions, or a history of kidney stones. Let's talk about real-world impact. Doctors consistently observe that seniors who consume calcium-rich foods with protein at night experience better balance, fewer falls, and improved mobility over time. Bone strength improves gradually. This is not an overnight fix, but consistency matters more than intensity. Even modest improvements in bone density reduce fracture risk significantly. But nutrition alone is not enough. Bones respond to gentle stress. Light resistance exercises, such as chair stands, wall push-ups, and slow leg raises, signal bones to retain minerals. Walking is helpful, but resistance matters more for bone density. Combining yogurt at night with light strength exercise during the day creates a powerful protective effect. Hydration also matters. Dehydration reduces nutrient transport and increases fall risk. Seniors should drink fluids regularly, even if thirst is reduced. Sleep quality plays a role as well. Poor sleep interferes with hormone balance and bone repair. Yogurt at night may also support better sleep due to its protein and calcium content. Now let's address a common myth. Some seniors believe dairy causes inflammation or bone loss. Research does not support this when dairy is consumed in moderation and without added sugar. In fact, fermented dairy like yogurt often reduces inflammation. Another myth is that only women need to worry about bones. Men also lose bone density with age, often unnoticed until a fracture occurs. Bone health is a lifelong concern for everyone. Before we close, let's review the key points. Bone loss after 55 is common, but not unavoidable. Food-based calcium is safer and more effective than large supplement doses. Plain yogurt provides calcium, protein, probiotics, and supportive nutrients. Nighttime consumption aligns with bone-building cycles. Vitamin D and K2 are essential partners. Medication timing matters. Consistency matters more than quantity. If you are over 60 and want to strengthen your bones naturally, start with what your body understands best: real food, proper timing, and gentle daily habits. If this video helped you understand bone health more clearly, support the channel by liking and subscribing. We share doctor-guided, practical health information designed specifically for seniors. Let us know in the comments where you're watching from and what bone health concerns you want us to cover next. Strong bones protect your independence, your mobility, and your confidence. The choices you make today shape how strong you remain tomorrow.